Hey everyone, welcome to my channel. My name's Kristen. I am a patient with obstructive sleep apnea, but I'm also a therapist, a licensed independent clinical social worker. So I'm trained to diagnose and treat mental health conditions. I post a ton about my sleep apnea and CPAP journey over on Instagram. It's the same name, me and my CPAP, if you're interested in following along there. But I am committed to putting more of this content on YouTube as well. So today I wanted to blend my mental health expertise with my patient experience of sleep apnea, not only myself, but in the years that I've spent as a patient advocate. And so today we're going to talk about how undiagnosed sleep apnea can look and feel a lot like anxiety. And recently I've had several people message me when I've posted about my own journey to diagnosis. It took me 15 years. They had similar experiences with long delays to diagnosis. Unfortunately, that's not uncommon. But for them, their symptoms were explained as being anxiety. And for some of those people, after treating their sleep apnea, their anxiety symptoms either improved or resolved completely. So what could be going on here? One of my favorite phrases as a mental health clinician is both can be true. You can have an anxiety disorder and have sleep apnea. It doesn't have to be one or the other. But what concerns me is the potential prevalence of people that are being treated for an anxiety disorder that have undiagnosed sleep apnea. And experts estimate that up to 80% of people that have sleep apnea do not know that they have it. And what undiagnosed sleep apnea does to your body and your brain can contribute to symptoms of anxiety. I'm going to tell you a little bit about why that may be and also when it's worth screening for sleep apnea risk. So, when someone has obstructive sleep apnea, their breathing is repeatedly becoming blocked, partially or completely restricted during their sleep. That causes drops in oxygen and it causes brief awakenings, whether you realize it throughout the night or not. And these events where you have drops in oxygen are called apneas. Apneas can be especially disruptive during REM sleep. That's the sleep stage that plays a major role in our emotional regulation and our mood. You have sleep apnea that's not being treated because you don't even know that you have it. Over time, your sleep that's consistently disrupted leaves you waking up feeling foggy, feeling on edge. During the day it can cause a lot of symptoms. It does look different for everybody, but some frequent symptoms are poor concentration, memory issues, lack of energy, or sleepiness during the day. And all of those things can make life feel more overwhelming, which can then intensify or perpetuate anxiety. One study found that anxiety disorders were present in 54% of newly diagnosed obstructive sleep apnea patients, and that's compared to 16.7% of people in the control group. But once your sleep apnea is diagnosed and treated, the good news is that treatment can lead to a reduction in your symptoms of anxiety. One study found that there was a significant reduction in clinical anxiety symptoms after 6 months of consistent CPAP treatment. So, what is the moral of the story here? If you have anxiety and it's not improving despite evidence based treatment, or if you also have any symptoms of obstructive sleep apnea, and I'm going to put them up here, it's worth screening for your sleep apnea risk and asking your doctor for further evaluation. There are several free screening tools that I will put in the caption, including the Epworth Sleepiness Scale, the Stop Bang, and the Sleep Disorder Symptom Checklist. Now, these don't by themselves say that you do or do not have sleep apnea, but it's a good starting point to determine if there might be something else going on with your anxiety.